Hey everyone! So today I wanted to make a video addressing a question that I get asked a fair amount when people find out that I have FAP and that I don't have a colon. And that's what kind of medication are you on? And I think people have this tendency to assume that because I have this pretty hardcore disease and I don't have a colon that I must have medicine coming out of my ear or something, which actually really isn't the case. Because again, there isn't a cure for FAP, which means there isn't really, a medicine that we can take to treat specifically FAP. So I think that the medicine that people with FAP are taking is really more in response to some of the things that FAP can cause. And I think it really varies from person to person and depends on their own experience with FAP. For example, the medication that I'm going to predominantly talk about in this video has really come out of the fact that I have a J pouch, which, yes, has been caused by me having FAP, but this medicine is applicable to anyone with a J pouch, not just people with FAP who have a J pouch. And I guess, if you have FAP and develop cancer, another unfortunate problem that FAP can cause, the type of medicine that you take because of having FAP will change in response to that. So again, I think it really does vary from person to person. And, the simple answer for me is, at least right now, at this point in my experience with FAP, I'm really not taking any medication on a daily basis because of FAP, but there have been some things that I've been prescribed and have purchased from the drugstore that I guess medicine related, because of having a J pouch that I just wanted to share with you guys. The first thing that I wanted to talk about are some drugs that might possibly be considered things that could sort of treat FAP. I don't know if I would go that far, but there's really not that much research out there on them. Just, these weren't things that my doctors told us about. They were things that my mom and I found through research of our own. And there are these drugs, one of which being quercetin. I don't even know how to pronounce it because I've never taken it, but I'll put the spelling in the down bar below. And then curcumin. Again, I've never taken it, so I don't know if I'm pronouncing it right. It's thought that taking these two drugs in combination will help reduce the growth of polyps in the colon and the rectum. And, it might be something to consider if you haven't had your colon or rectum removed, because it might prolong the amount of time that you can live with your colon. But for me, it didn't really seem like it would be useful for me to be taking these, just because I've already had my colon and rectum removed, and it doesn't seem like these are preventative, so they're not going to prevent other FAP-related things from happening. But I mean, I think it's definitely something to check out. And then I guess along the same line is another thing that a few studies out there have found to be useful at reducing desmoid tumor growth, which are NSAIDs, and those are non-steroidal anti-inflammatory drugs such as aspirins. And the big one that they've been looking at for people with FAP is called Sulindac, which I'll put in the down bar below. And, I'm not taking any NSAIDs yet because I don't think, from the research that I've found, they're preventative, so that, they're not going to prevent desmoid tumors from forming. They'll just slow down the growth of already existent desmoid tumors. But I don't know. Again, another thing to check out, and, there really isn't that much research available, but, there's no harm in typing it into Google and seeing what you find. And then I guess now moving on more onto things that I've actually been prescribed and have used. The first thing being probably one of the biggest, which is painkillers. I don't know if you can see that. This is tramadol. And I've been prescribed several different painkillers in the process, predominantly oxycodone, I guess, and what type of painkiller you're prescribed really depends on your surgeon. But I'm not still taking them now. They're really just prescribed for the first few days after each surgery, and yeah, they're definitely something you'll encounter if you have a J-pouch surgery and you'll be prescribed. They were definitely helpful in the time, but I'm not still on them now. So, and then another thing that I was prescribed right after each surgery is something that I don't have actually here right now, which just goes to show you how long it's been since I've last used them, and that's Ativan, which is an anti-anxiety drug. And I was just using it to help me go to sleep because after the first few surgeries I was having some trouble getting to sleep. So yeah, but I haven't used it in months, so it's not like I'm using it on a daily basis or anything, and it was just something that I found helpful in this whole process. And then I guess to go in chronological order, this is something that I used while I had my ostomy, and it's called nystatin powder. And I was prescribed it because I was having trouble getting a good seal with my ostomy bag, so I was having really acidic poop just sitting on my stomach, and it caused my skin to develop a rash, and it became really itchy and it burned, and it was just a really uncomfortable experience. So, this stuff helped a bit with that, and if you're having similar problems, yeah, it might be a good idea to ask your doctor about this. And that's really the only thing that I had during my ostomy. And oh yeah, I guess this is another thing that was prescription-based that I should mention, and it's Differin, which is an acne prescription medication. And I really have it here just as a reminder that as a result of the stress from being diagnosed with F.A.P. and then having the J-pouch surgeries, I developed acne. And, before being diagnosed with F.A.P., acne wasn't really a big problem for me. So, it's definitely a new thing that I think came out of being diagnosed with F.A.P., which I've been taking various prescription acne medications for, and hopefully one day something will work. But yeah. And then the rest of everything I have here is non-prescription stuff. And it's also more J-pouch related things as far as like after the reversal surgery. First of which is something I mentioned earlier, which is calmoseptine. And if you suffer from the infamous butt burn like I do, it's a really useful thing to have around. It's just a nice soothing menthol-y type cream, which has been a bit of a butt saver, so to speak. And I use it every time I go to the bathroom, and it's not prescription. You can find it in your drugstore, but you may have to find it in the pharmacy section of your drugstore, and since it's not in high demand, you may have to have your drugstore order it for you, but yeah. And then another drugstore purchase that I made because of the J-pouch is this Mederma Scar Gel. I don't really know how effective it is, but I'm still using it pretty religiously just to try and minimize the visibility of my scar. And then next thing is something that I was taking before I was diagnosed with F.A.P., but now that I have my J-pouch, I'm definitely noticing that it helps me more and I can sort of feel its effects a little bit. So it's definitely more of a part of my daily routine than it was before, and that's just a multivitamin, and I of course have gummy vitamins just because they're tasty. And I mean, but again, they're, multivitamins are a good idea for anyone, whether or not you have F.A.P. So, and then there's biotin, which you can find at your local Whole Foods or health food store, and I am still taking this because, particularly after my first surgery, I lost a fair amount of hair, and I mean, I was fortunate enough to have started with a pretty thick head of hair, so it wasn't too noticeable, but I mean, I was noticing it, and when I'd see people for the first time after having my first surgery, one of the first things they'd say to me is, "Oh, did you get a haircut?" And I'd just be like, "Nope, but I've lost a lot of hair." So I mean, it was definitely noticeable on some level to other people. So I did my research and found out that biotin can be pretty helpful with hair regrowth, and it's actually also really useful for nails. So yeah, taking that in combination with using Nioxin shampoo, I've definitely noticed some hair regrowth. So it might be something to check out if you're having a similar problem. And then the last few things I want to talk about aren't things that I can show you, one of which is a medicine that I definitely took throughout this whole process, and that is an iron infusion. And people with F.A.P have a tendency to be anemic, and I was diagnosed as being anemic way before I was diagnosed with F.A.P, but when I received my F.A.P diagnosis, it became a bit more clear as to why I was so anemic, because I had all these polyps in my colon and rectum that were bleeding, and losing blood is one reason to be anemic. So I underwent one cycle of iron infusions right after being diagnosed and before my first surgery, just because my hemoglobin level was so low that my doctors wanted to try and raise it up a bit before having surgery. And then I'm currently undergoing one right now. So yeah, but I think I'm going to try and have a future video where I'll show you some footage of what it's like to get an iron infusion and talk about that a bit more. And then the other thing is something that I actually am not taking right now, just out of, it's a personal choice. But I just wanted to mention because I know it's really big in the J-pouch community, which means that, there are people with a J-pouch who have F.A.P who are taking it, and that is a fiber supplement. And, whether it be in a pill or a Metamucil cookie or a liquid drink sort of form. The fiber helps to bulk up our stool, and if you've ever taken an intro bio class, you've probably learned, the only thing you've probably learned about the colon is that it's responsible for absorbing water. And since we don't have a colon, a lot of water just goes right through us and ends up in the toilet. So the fiber helps to sort of, bulk up the poop so it's not as watery. But yeah, I just wanted to mention because it is a really big thing that a lot of people who have J-pouches take, including people with F.A.P. So yeah, and I guess along that, because we don't absorb water as much as the average person, we're more prone to dehydration. So it's really important for all of us who have a J-pouch to really be conscious of how much water we're drinking and make sure we drink a bit more water than we used to. And water, I know, is not medicine or anything, but for us it's definitely very health related. So yeah, I mean, I think that's it. So as you can see, there's really not a lot of medicine that I'm taking on a daily basis because of F.A.P. I hope you find this helpful, just to, sort of give you an idea of what it's like living with F.A.P, I guess medicine-wise, and, if anything changes as far as what medicine I take, I'll definitely give you an update. But for now, if you have any questions or comments or video suggestions, comment below or message me. Alright, I'll see you later. Bye.